Hey Facebook, it's Sarah McLeodry from Synergy Behavior Solutions. I'm trying to make sure this camera angle is okay. Welcome to our Tuesday Live, and we are going to talk today about senior dogs. And I set this whole shot up for my senior dog to be part of the shot, and she just got up and left. Of course, that's Rizzo, the joy of a senior dog. So a little bit about senior dogs. What age do dogs become senior? It kind of depends on the size dog, things like that. Most dogs, it's after 7 from the veterinary standpoint. Large breed dogs, it's sooner. Small breed dogs, it's later. But on average, it's 7. Oh my God, Rizzo's being naughty. That's kind of her thing as an old dog. Actually, it's kind of her thing in general. So let's see if we can. Rizzy, go on your. Oh, she's going to jump on the computer screen in about 2 seconds. So we're going to talk a little bit about really about cognitive dysfunction today. I've had some experience with that. Unfortunately, I think I'm having some experience again. We're working on diagnosing it with actually Dr. Volley. So a lot of times, I think growing up, people just like, oh, that's an old dog thing. That's an old dog thing. That's an old dog thing. And kind of dismiss a lot of behavior changes as just being an old dog. And we know now that there are things that we can do to help those older dogs, to help them be successful, and that there is a canine cognitive dysfunction that we can actually treat. And so the first thing we always look at when we're talking about senior dogs and cognitive issues is what they call DISHA. And we're going to talk about each part of what DISHA is, like the world's worst acronym ever. And DISHA stands for disorientation, interactions, and they mean social interactions. Changes in S is for sleep-wake cycle. H is for house soiling. A is for activity, and the second A, because it's dish is anxiety. And so first we're going to talk about. I'm laughing because Rizzo just is now sitting behind the computer. Disorientation. So I think a lot of people, when they think of cognitive dysfunction in relation to old dogs and disorientation, most people think about those dogs that go and sit themselves in the corner, or they can't figure out how to get out a door. And you really need to think about disorientation in a bigger way and know your dog. Because if we wait until those moments of disorientation where your dog is getting stuck in a corner, it may be a little late to have some of the veterinary medications and therapies that we have help them, because it's pretty far progressed by that time. But I have to say, having dogs with some cognitive issues aging, there are lots of signs of disorientation way before that. So one of them I've seen is just, kind of sitting outside and just staring off into space, maybe kind of forgetting where things are, those kinds of things. But it's really about knowing your dog. If there's something that changes in how they interact with their environment, that is a big difference with the disorientation. When we talk about the I in DISHA, the interactions, social interactions, that's an interesting one too. Once again, it's really much about knowing your dog. Hi, Diana from New Zealand. Welcome. That's super exciting. People from the other side of the world. So social interactions, and that's actually a big thing I've noticed with Rizzo is notice how she was laying on this nice chair when I started this talk, and then she decided she needed to get up. And she really has, as she's aged, her interactions with me have changed dramatically. And she doesn't like to be touched as much. She doesn't like to be interacted with. For a long time, I was kind of chalking that up to just like she has a lot of health issues, and I have to do eye drops and ear drops and creams and stuff like that for allergies. And I thought maybe some of that avoidance was that, even though I do them positively and we have trained behaviors and all those things. But I'm really starting to think now it is a change in social interactions that is a bigger picture. If we have her nose work harness on and her leash and we're going out to do nose work, it's very different. Her social interactions are completely back to what I would call normal for her and I social interactions. But here at home, they've changed dramatically. It's very interesting to watch. And she's actually become much more social with my husband. And she likes to go up and sit next to him and get pets from him and things like that, which she never used to do either. Sleep-wake cycle. That's another big one. That's usually the one that gets most people to call their vet. Being kept up at night by your dog is horrible and frustrating. And when we say change in sleep wake cycle, it also means if you've noticed a huge change in your senior dog sleeping a lot more during the day, it may not just be a change in when they're awake or when they wake up at night, things like that. But also, we have to remember there's a lot of these things that we're talking about with senior dogs can have other reasons for them. So Dr. Volley had a dog, Jazz, who recently has passed away at very nice ripe old age for a Shepherd Husky mix. I think he was over 15. But he was having a problem where he was waking up at 3 in the morning, keeping Dr. Volley and Scott awake for hours on end at night. Very, very exhausting. And it actually was not cognitive dysfunction. He was having an increase in pain, and his pain medications were wearing off. So you have to look at the big picture of all of these symptoms. And that's why it's really important to see a specialist, a veterinary behaviorist, or a veterinarian who specializes in behavior to really get a full picture of what this could be. Could it be pain? Could it be other health issues that are starting to crop up? Or is it truly cognitive dysfunction? So we really want to think about that. It made a huge difference once with Jazz and Dr. Volley, they really had to tweak his pain medications a lot to keep him comfortable throughout the night. And that was a big difference once they did that. The H in DSHA is house soiling. So we definitely see a change for some animals where they will start having accidents in the house that is not related to other senior dog issues of incontinence and other muscle tone issues, things like that. So that's where the house soiling gets a little tricky also, because it could just be a lot of other issues for house soiling. But definitely, if it seems to be more cognitively based, then that's what we want to look at for cognitive dysfunction. And then activity. So activity being, do they want to go out and do stuff with you? Are they comfortable? But that also, once again, could be other issues. You could have joint issues. You can have arthritis, things like that. So watching though, activity that they used to love, they don't love anymore. They're not wanting to go out with you on the car, things like that. So that would be one of the things we look for cognitive dysfunction. And then anxiety. So anxiety can come in lots of forms, but one of the most interesting forms that I've found over the years working with clients and their dogs with cognitive dysfunction and with my own dogs is changes in separation anxiety. So my first dog that had canine cognitive dysfunction was Dara, my Nova Scotia duck towing retriever. And the big change I saw at a pretty young age, it was about 10-ish years old, she was a very, very easygoing dog. She was super used to being left home alone, going with you, she was an all-around, what we call bomb-proof dog. And all of a sudden, Dara started toddler screaming. And if you don't know what a toddler scream is, go Google it. It's awful. Every time we would leave the house, she would just start screaming. And this was something she had never done for 10 years, had no problems being left home alone. And it was a huge change in her behavior. And it wasn't a sudden onset yes, it was a sudden onset of separation anxiety, but it had nothing to do actually with kind of the traditional reasons for separation anxiety. It completely was cognitively based. So for her, the reason why I finally went to my vet to talk about things was we saw the increase in separation anxiety. She was active in nose work at the time also, and I remember setting up a nose work find where the wind was blowing right at her face at nose level, and she started to search and she just stopped and she just stood there staring at me like, I have no idea what we're doing out here. And she was a super searcher, and so that was a huge change in behavior for her. And then sometimes she would sit in the yard and just kind of stare. And she wasn't getting lost. She just would kind of stare and be very disengaged. And for Dara, in the yard meant ball time, playtime. She was never disengaged in the yard. So that was a huge change. We started her actually on a supplement called Senna Life that's over the counter. And we saw some marked improvement, but not as much as I wanted to see as living with her, listening to this toddler screaming every time I left the house, which then stressed me out because I loved her dearly. And so we actually went ahead and put her on medications for canine cognitive dysfunction, and all of those symptoms completely went away. We had no more separation anxiety. She was back to working. She continued to compete in competitive agility. I'm not sorry, she never did agility, competitive obedience and nose work until she was about 13. So we got about 3 more years of having fun with her, doing the stuff that she loved. And it really made a big difference in the longevity of our relationship together, because nothing's worse than having spent this wonderful life with your dog and having a great relationship and have it change due to cognitive dysfunction as they age. And really, I've seen that with clients where it really sours their relationship with their dog as these things are changing as they age. And so being upfront with your vet and talking with them, making sure that these symptoms are happening, starting a log of these symptoms. So with Rizzo, she's now 10 and a half. And we started to see some cognitive changes in my mind when she was probably about 9. And they weren't radical, a little bit of, staring off into space, some changes in some things. But now we've had an upswing in her social interactions with me. And we had a big change in her sleep-wake cycle. So we're dealing right now with that, with just using some medications to help her sleep at night. And that's made a big difference. The other thing that we've noticed with Rizzo on her cognitive side is her need for predictability has gone off the charts. If you are off of her schedule by a minute with feeding or time to do her eye drops, even anything, a change in her schedule, she is out of sorts. And when Rizzo is out of sorts, that means whining at you, bouncing, moaning, barking, all these kinds of behaviors that weren't there. And this week, the new one was definitely, she doesn't need eye drops right now. And so that routine of doing eye drops every morning changed. And she is not very happy about that change in routine. So thinking about, as your dog ages, keeping track of what are the differences? Do you need it when you talk to your vet? Is it cognitive? Is it something physical going on? We really talk about cognitive dysfunction as being an issue of rule out. We made sure that the house soiling isn't due to a change in renal function or other things. Are they having osteoarthritis issues that need to be dealt with, allergies, all sorts of different things. And you really need to look at that big picture. And you have to keep those lines of communication open, because there is treatment for all of those things if you keep those lines of communication open and find out that they are not cognitive. Then you can deal with it physically. And then if it is cognitive, there is still treatment. And that's the big thing to remember. So who out there, got a couple people watching, has an older dog that you feel like, got some questions about, let us know. I've seen changes too. I have a client, a good client that does nose work with us. Her dog started having some seizures in his old age and he lost his hearing. And so that's been a big change for them. But it isn't cognitive based. It is a secondary to his seizure disorders that he's having right now. And so you never know what's going to change. And it's really important to keep that up. I wish you got, maybe I'll turn the computer around so you all can see Rizzo and her ridiculousness. All right, there's Rizzo. She was just stretching and looking super cute. So she's an American Water Spaniel. And now, see, there's that social interaction. She's like, I'm out of here. She's like, oh no, you're going to touch me. I know it. And so she's like, instead she knocked over my water. Hold on one moment. So part of Rizzo's thing too is impulsivity. But that has always been something that we've worked on with her. I would not say it's part of her cognitive issues. And it's just something about her that we love and we constantly work with. So if you have any questions regarding your dog aging, cognitive issues, we are having a webinar tonight. Today is Tuesday, December 8th, 2020, and at 5:30 p.m. at Pacific time. You can sign up on our website at synergybehavior.com. And if you can't attend live, you are more than welcome to sign up and we will send out a recording of the webinar later. Hi, Kona's Touch. Yes, I know she's a cute dog. She's naughty and I love her. And she's very cute. I think as many of us trainers say, thankfully our dogs are cute on top of everything else. And she is very cute and a very special dog to me. So once again, if you have any questions, please let us know. Go ahead and feel free to leave them in the comments or join Dr. Volley and I are doing our talk tonight more in depth about senior dog issues, not just cognitive dysfunction. And we'd love to share that with you. You can sign up once again, our website, synergybehavior.com. And thanks so much. And I look forward to seeing you guys soon. Bye.